Hello. Hi. So this is Christine, and I was invited to be involved in this project because a family member is involved in this project and was aware that there are a lot of deaf people out there who need a better understanding from medical staff and medical teams, need to understand better how to allow deaf people access into the medical field in that process. So I was, you know, going to talk about, he knew about my process, my journey process of having breast cancer and this journey. So she invited me to be part of this process so I could share that information and my experiences. And I asked my dear friend, Sara. We've been good friends for many years now. And I feel comfortable. I felt comfortable asking her to be involved in this because I feel like I can really express from my heart. And this is Sara, and I love that so much, and I really appreciate you inviting me to be involved in this process too, because, right, we have shared many things over the years, good, bad struggles, and it's always been nice because we feel comfortable expressing ourselves, but also we trust each other and we support each other. So I'm honored that you invited me to be involved in this process too. Hello, this is Christine. I'm a deaf woman. I have cancer, and I'm here talking with my very close family. When I told my family members about this opportunity to hear me now, most people are like, wait a minute, they've never heard about a perspective of a deaf person with cancer and going through the medical field. So I asked my good friend Sara to be involved with this too because we've known each other for several years. And so it would be a very easy conversation to have with each other. And this is Sara. And I'm going to be the voice of both Christine and myself because I'm also an interpreter in addition to a friend of Christine. And we've known each other for a long time, and we've shared lots of good times and difficult times. And I look forward to just hearing about and talking to you about your perspective and experience of going through that medical field with your experience with cancer and recovery. And continued recovery, I hope. Christine saying hope too. Oh, my journey's not over yet. But it's getting there. And I have noticed some things are getting much better now. So it continues. So, like, for example, when I first moved here, I was from Wisconsin, and then I moved here to Washington State. The first thing I did was I was looking for a doctor who was near my home, because I wanted to be in a very environmentally friendly way. I wanted to go to a doctor near my home. And so I took my three daughters and we went to go see the doctor. And at first one, the doctor said, "Oh, you became deaf because from the tropical disease. And my three girls might be carriers." And I was like, what? What, here in Washington State? You would say that? I was stunned and shocked. I said, no, 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 no. There are many, many different reasons and paths for people to becoming deaf. And the doctor was immovable on this. I was devastated. I thought, and I didn't have time to look for a doctor for my other daughters. And then later there were other ways that his thinking was so wrong. So I thought, no, I needed to find another doctor, and it took a little bit more time, and I did find a better doctor at that time. And it was, the medical profession now has become more aware of what's out there, and that you don't become deaf from one particular cause, that there are many paths for this. You know, it could be for a variety of different reasons. It could be this or that or another reason. There's no one size fits all. So it's like you're deaf. Okay, let's just move on. And I really appreciate that. And Sarah is saying, I just know from other friends who have brought like their deaf kids to the doctor or a clinic or the ER. And it's like, I had one friend who brought in the ER for a broken arm. And the first question from the doctor's mouth was, so how did your son become deaf? And my friend's like, it doesn't matter. Look at his arm. I'm not asking you to diagnose his deafness or deal with that. Move on. Let's focus on what the need is. And Christine is like, yes. At one time, I went to the ER with an issue with my knee. And I had a good friend that came with me. And there's this kind of unspoken rule in the deaf community that I would never tell my friend that, you know, your voice isn't very clear, it's not very good. That's considered rude and mean and judgmental. So I didn't say anything like that. But my friend was thinking that she was speaking clearly. Anyway, I kind of discouraged her from talking to the doctor because the doctor came in and it's like, oh, and he saw and talked to the two of us, and then he labeled us and assumed we were mentally retarded. I was like, what? Wait a minute. That's got nothing to do with my knee issue. And it was because of my friend speaking her best, but she didn't realize she wasn't clear. And the doctor just, because of that one thing, assumed we were both mentally retarded. Ugh. And Christine, Sarah is asking, Christine, do you feel like if you went to the ER today, would it be a better experience? Christine's saying, oh yes, now it's a much better experience. Like recently, my husband broke his hip. He was on a bicycle and fell, and he didn't even know that it was broken for a week. And so it was a week later that we went to Harborview Hospital. And they looked at him and said, oh, okay, we've got a deaf patient. Great, let's get the interpreter. They got the interpreter. They talked to my husband directly using the interpreter. It was perfect. It was great. It was smooth. They didn't ask him, did you hurt your knee because of being deaf? They just dealt with him as they would deal with any other patient, but going through a qualified interpreter. It was great. And Sarah's saying, well, that's finally a relief. I'm happy to hear that. I mean, I'm sorry that he broke his hip. I know, it's kind of a funny story. Christine is saying that, I mean, he went through a whole week and he didn't even realize it was broken. Oh, my husband. I also wanted to say, you know, Christine is saying, the doctor doesn't need to assume that why I'm deaf. Just be professional and do your job. And you know, if I'm diagnosed as deaf or not, if it's not related to what I'm there for, let it go. It doesn't need to be part of that appointment. Yeah, it can be tough. So, I know, this is Sara speaking, I know from my experience that sometimes I'll get a call from a doctor's office or an agency, and they'll say, can you come? And it's like, what, you know, and often they'll say, we have 3 different days and times. Can you get any one of them? And so I try to work with that, of course. But do you have to struggle like that? Do you have to, when I call to make an appointment with a doctor, they give me a day and time and I say yes or no. But do you have to really come up with 3 different potential appointments? And Christine is saying, they never ask me. Well, they haven't anyway. They've never asked me for 3 different possible dates or times. That's never been an issue for me. But I do know sometimes I show up, and unfortunately, more often than not, I get there and they're using VRI. And I do not like that at all. And I've given them a lot of advance notice, like so often more than a month to find an in-person interpreter, and they get stuck with this VRI. And it's video remote interpreting is very difficult because often the connection is bad. And if you've ever been on any kind of video chat, you know that sometimes there's lag or it pixelates or it stalls. And there was one time with this surgeon, the connection was so bad we defaulted to writing back and forth. And so I said that the next time with the surgeon, I said, no, I have got to have an actual interpreter there at that day and time. And I checked to make sure, it's like, did you schedule the interpreter? I kind of got a bit of an attitude, but they did say that they did find it, and they said I asked for a specific interpreter, and what they ended up getting was one of the interpreters that was on the list of I do not want this person at all. And then whoever was scheduling said, oh, I didn't realize I missed that part where you said I don't want that interpreter, but I want these 3 other ones. Because if one of those interpreters that I don't want on there show up, then I just don't even try to talk. I get very protective of myself, and I don't want to say anything because I don't trust that interpreter. So some interpreters, it can be really bad when they don't respect what my wish is about which interpreters. And this is Sara, and I'm just going to take a minute to kind of explain VRI compared with in-person. So video remote interpreting is an opportunity for a person to use a laptop or some sort of computer equipment via the internet to connect to an interpreter somewhere else in the country. And it's been used off and on for, I don't know, maybe 10 years. And of course, during COVID, it got very popular because we weren't allowed to go into many situations. And so VRI is I think it's a good last resort. But there's so many issues, like with Christine was saying, that the connection is bad. It pixelates, it stalls, or it disconnects. It also takes time to set it up. Sometimes the staff is not aware of how to do it. VRI has to be set up in advance so that there's an interpreter specifically available. And as an interpreter, as a VRI, it's very limiting because I'm not there. So the doctor will say something like, oh, well, when you do this, or can you move that, or over here, I don't know what he's pointing to or what he's saying. And so it gets it's very awkward and it's very difficult. And it's also hard for me to ask for clarification sometimes. So VRI it's one option, but it's not a great option. And so some deaf people are fine with it depending on what the situation is. Some deaf people really want a live personal interpreter in the room so they can get all of those nuances and just all the communication. So this is Sara, the interpreter, speaking. That's really important to check with the deaf person what they want, not just what the office thinks is more convenient. So to just be respectful of that. And Christine is saying, a very good example of not showing respect of my needs was after one surgery. Let me back up a bit. I was chatting with my surgeon. I was meeting with my surgeon in advance, and I wanted him to tell me what's going on with my shoulder because I didn't really understand. And he's like, oh, it's fine. And he told me all these things that he did after the surgery, and that was great. He said it's all good. Then after the surgery, the interpreter came out in the recovery room, and she's like bobbing and weaving a lot and moving around, and she's saying, do you understand what labrum? Oh, did I spell that right? And so she's going back and forth, and she's like, just her facial expression and her and her sign and her approach to me, and I couldn't sign very well because I just had surgery on one shoulder, had an IV in the other arm. I couldn't really move a lot, and I tried with my facial expression to kind of think, what are you doing? And I didn't appreciate her attitude. She treated me like I was an idiot. I was uneducated or unaware what's going on. So then after I got out of recovery room, I talked to my husband and said, what did the surgeon say? The surgeon gave me all the prep information, but what did he say of the post-surgery? And my husband said, he said it was fine. And that was it. And so I was so angry. When I got home on a Monday after the surgery, I sent this whole email saying, what happened? What was going on? Why didn't I know any of this information? Why didn't you tell me anything? The interpreter was lousy, was not appropriate for my needs. The doctor was very apologetic and said, oh, I'm so sorry, I didn't know that. So at that time, then the doctor went through and explained everything was happening. But I had to get through the whole weekend not knowing all of that information. It was very, very frustrating. Oh, and another thing Christina's going on about VRI, video remote interpreting, is you don't have any idea who the interpreter is going to be. And so that recent story I just told about my shoulder, now after that, I say my husband has to be with me the entire time, pre and post. I do not care about COVID because he needs to be at my side for my communication needs. And we have argued with staff right and left, and they finally gave in and let my husband come in with me, which is a really good thing because he watches that VRI interpreter, and he knows that I'm nervous, and this whole thing, and sometimes I have to, during the course of my cancer treatment, I have to actually disrobe and expose my breasts, and now I have to do it in front of this VRI interpreter. It's very embarrassing, and I don't like that. And I've got 2 male doctors there too. I asked for a female doctor, but I was so nervous, and all of this was going on. It was so stressful. And I kind of tried to make a joke with the surgeon because the doctor, said, okay, so do you know why you're here? I said, oh yeah, you're going to take off my boobs and throw them away. I was trying to lighten the mood. I was trying to get a joke. And my husband watched the interpreter, and the interpreter kind of went, oh, just take off my boobs. Mm-hmm. And my husband was so pissed. He just lambasted and just said exactly what I had said. And then, of course, the surgeons laughed, and the whole medical team did laugh, and it did lighten the mood, and I was grateful for that. So I need to have that, and so that's why I need to have an interpreter who I can see and understand, and is saying exactly what I say. I don't care about their feelings or their opinions. You need to say what I'm saying. And because this is my surgery. And this is Sarah's like, oh my God, I am so sorry. And I know it happens, and hopefully that interpreter straightened up and did more matching your needs. It's hard, and I know it's hard, and I know that if I go into a situation and like I see a family member there, I immediately give them permission. I say, look, you know them better than I do, and if you see something that you think I've missed, or there's a specific sign, maybe it's an inside joke or something, and I'm not getting that whole nuance or the whole feeling of that, just jump right in and say it. And most of the time the family's like, oh, really? It's like, oh, I don't want to step on any toes. I don't want to insult you. And it's like, I'm here for communication. So if it's not happening, feel free to take it over. So I'm glad your husband was there. And Christine's saying, and my 3 daughters, they always say that. Like they're watching the interpreter when we're in a doctor's office or whatever, and they'll catch the interpreter, and they'll kind of whisper to the interpreter, kind of let the interpreter know what they missed, and to make sure the communication is clear. So it's done in a very respectful way, but it also makes sure that my communication needs get met, which is really, I really appreciate that. Hold on just a second. Oh, another thing I wanted to talk about that we need, it's it's different than regular hearing people. Like for when I was pregnant with a baby, the doctor looked and said, "Oh, you're deaf. You can't hear the sound. Okay, well, ultrasound is not fair for you to listen to the heartbeat, so that's not appropriate." So they brought in an ultrasound machine so that I could actually see a screen and see the heartbeat of my baby. I was so moved. I love that doctor so much. And I went back to that doctor all the time because he's very sensitive to my needs. And anything related to sound, that doctor found a workaround and would show me that was aware of my needs and didn't care, but just made sure it happened and was really comfortable with communication with me. I so appreciate that. Another thing is if a doctor doesn't show the sensitivity or understanding, and I tell the team that I want to work with this, for example, there's one time I wanted to work with a specific physical therapist. I'd been working with this physical therapist for a while. We had a good relationship, and the medical team was saying, no, you have to work with this. Their physical therapist who's been trained with this. And it's like, no. I know this physical therapist. I have easy communication with this person. And if I go to your physical therapist, good Lord, I'm going to have to start all over again. And it's a lot of work that I now have to add to my plate to start all over again with a new person. So it's one thing I always have to fight for. This is Sara saying, I get it. I often, when I go into any situation, I have to say, have you worked with an interpreter before? And then I can give them a quick little 1 minute how to work with an interpreter. And I know that as a deaf person, you not only have to do that education, but you advocate to really get what your needs are. And like you said, you have a list of preferred interpreters and a list of do not call interpreters. And that's like every time you meet a new, not even just a new medical person, but a new receptionist or a new, admin person that you have to start all over again. On top of going through whatever your medical needs are. It's exhausting. Christine's saying, I know, hearing people think it's no big deal. Oh, just whatever, male, female interpreter, doesn't matter. No. My first cancer team, my first appointment, they brought in a VRI, a computer, and it was a male interpreter. And I was like, oh, I was so upset. I said, oh no, I do not want a male interpreter. I'm going to already have to show the group in this office my breasts and a disrobe. I do not need a male interpreter in there too that I don't know. No. My cancer journey needs to be private. And I wish that all the people in my team were female. That would have been my first choice. I didn't get that choice. But I had to swallow my pride, and there was some male medical staff on that team. But I know in the interpreter field, I can absolutely request a female interpreter. And I want the medical staff to understand that. A female patient is going to prefer a female interpreter. And a male deaf patient is going to want a male interpreter too. I mean, and we're already having to bring in one more stranger to be a part of this. No, I was not going to accept a male interpreter. Oh my God. Sara, I'm so sorry. That's mind-blowing that would happen. And Christine's saying, Did I tell you about the time that happened? Oh, it was like 11 or 12 years ago. There was a medical task force team of deaf people who actually traveled around the state of Washington interviewing people. And they interviewed one woman who had cancer, and she had gone through so much and so frustrated trying to go in to get an appointment to see the doctor. And they said, "Oh no, you have to bring your own interpreter in." And the deaf woman was like, "No, no, no, no. You were supposed to find an interpreter. That's not my responsibility." And met with resistance. And finally, at the last minute, they said again, no. And she just said, "It's it. I'm done. I'm done." I went home and she went home and told her mom, "I'm done with all of this, fighting them every step of the way. Let me die in peace." And so she went home, and she was dead within the year, just because the staff were too lazy or ignorant to know that they are required by law to provide a sign language interpreter. This is Sara speaking. I have no words for that. I'm just at a loss. I can't believe that. Her mother, Christine is saying, the patient's mother was crying. She was devastated to hear her daughter was giving up and just let me go home in peace. Let me be at home. And why did the staff not respect her needs? Oh, when I heard that story and then I found out that I had cancer, I thought, oh my God, I hope I don't have to go through the same thing that she did. And so far, I mean, I've had some struggles. I've had to stand up for myself. I had to advocate. I've had some discussions with the staff. Sometimes I got angry, but I did get what I need. I mean, I've still got a way. The whole profession's got a long way to go. Well, and this is Sara, and I'm happy that you're still fighting. I want you to stay for a long time too. I am hoping for the day that the two of us can get together and just hang out and do the fun crafts and things that we enjoy doing together. So please keep fighting. Christine's agreeing. So you told me before that deaf people often have different questions than hearing people do in the medical office or whatever. Like, can you tell me more about that? What example? Well, Christine's saying, we've had a lot of questions. Like, a lot of it can be related to sound. Like, we think we see the world. And if you explain to us about, like, the heartbeat, it's like, your heartbeat sounds normal. That doesn't help me. If you show a beat, like your finger on your hand, or try to show the rhythm, or if you're explaining, if there's like a big medical term, don't ever say, "Does that make sense? Do you understand?" Ugh, so insulting. If you want to make sure people understand what you're saying, then just include it in the conversation. Just be excuse me, the interpreter's clarifying, a more conversational style. Like, if you have metastatic cancer, or, if it's metastasized all over, you use that medical term, well, it'd be helpful if you stop and say, well, statistics, or if you kind of say, it kind of, some people who have this might go through this kind of thing. Don't ever stop and say, "Do you understand this?" It's demeaning. And then, so vocabulary, sounds, trying to make sounds more visible. If I need an interpreter, and there are a few interpreters that I ask for. I'll say, I want to use these interpreters. And I don't want to use these other interpreters. I don't need to explain that. Just respect my choice. Please. Now, if you bring in one of the interpreters that I said do not, do not bring in, I shut down because I know I'm not going to be able to communicate with you. And this, I won't going to be able to express my concerns because I'm limited by the interpreter that you put in there. So please just respect my wishes. I need to feel comfortable. I want to be able to talk with the doctor, and I want to talk to the doctor, but I also have to deal with the interpreter. And that's a lot more work for me. So I need, in this situation, I especially need to have less work. I need to be with an interpreter I know I feel comfortable with, I trust, and that I can fully express my needs or my conversation with my medical team. And this is Sarah saying, that just makes so much sense. It's like, duh. Why do you not think that? And I know it's hard, especially to tell an interpreter directly that, like, you don't meet my needs. And so it's just better if you tell what you did. You told the staff the list of yes and the list of no. And maybe you should, this is so stupid that we have to make more work, but to say, put the yes list at the top and make sure that the no list is at the bottom so they don't automatically just start at the top of the list. And that's the other thing that it's a little amazing and sad for me, is that everything is so much more for you when you go, or for deaf people when they go in. I mean, you're already dealing with the diagnosis of cancer. You're already dealing with a whole new vocabulary and looking at, what are my options? What am I going to do? How's it going to affect me? How's it going to affect my life? Just the myriad of questions that people get when they hear that diagnosis or any other serious medical diagnosis. And then you have to add to, it's like, wait, is the interpreter getting it? Do I understand? Or do I trust that the interpreter's understanding what the medical staff is saying? It's like so many more layers on your shoulders. So I agree. I just kind of feel like anything anybody can do to make it lighten that load. Christine's saying, oh, speaking of which, deaf needs are different than hearing needs. And because we're very visual people, which means when you spew out these words and you say like sound, and the interpreter will, put it out there so we can see it, but we might need it to be, the interpreter's getting clarification, hold on. What I mean is, if I call Sarah, I put it in there as I can't hear this, and then Sara, so I hear, you guys all hear the name Sara, and I see the name Sara, and I need to see it at least 6 times before I actually can memorize it and it sticks. Hearing people hear the word or hear the name, and they get used to it quicker. And for deaf people, we need to see the name, and we don't just get it. If we get it one time, it's not enough. It's really helpful if we get written notes, things we can go home and review, and kind of bullet points of, this is what we talked about today. Because if you spew out a lot of information, I'm not going to retain it all. It's so much helpful. It's so much better if I can get it written out, and then I can go home and review it. Same thing with hearing people when they go into medical team. They'll say, they'll actually ask me if you do want a recording. Do you want a video record or an audio recording of this meeting? And I'll say, well, can you get a transcription of it? And they'll say, oh yeah, we will. And it's, to date, it has never happened. It has never happened. So it's like I get home and I'm looking at these brief notes, and I want to go home and I want to be able to read and study and remember. I want to know, and I want to be able to talk with other people and see what's going on. And that's what works for me, especially with, I need to know what's going on with the breast cancer. And so it's a triple negative for me. It's so many things that are impactful. The interpreter's getting clarification. I've got triple negative breast cancer. And it means that it's not going to respond well to hormones. It just won't. It does not respond well to that. So it's a very aggressive form of cancer. So I really wanted to be able to get that transcript to go home and read and study and use that transcript information about my experience, about me that we just had, to be able to read through that and pour through that and study it and do some research related to that meeting. But they never gave me the transcript. So it's just like, again, it's just creating more and more work for me. And it would be really nice if they had a note taker, scribe, or something that they could, taking notes during the meeting, and then I could bring it home and use that. Oh, also another thing about video remote interpreting is that they come in, they set up all the equipment, and they get all set, and then they speak to the interpreter, and I'm supposed to be able to see the interpreter, and the interpreter is supposed to sign everything they say that the person's already spoken. It's like, no, they have to there's this whole process of setting it up. And so I've already been turned off before it even starts because they're already talking without letting me know what's going on. And so suddenly they'll say, okay, you ready? So they come in, they set it all up, they do all the speaking that I don't understand. And then finally the interpreter says, okay, ready? And then the question is, do you want water? I say no. And then they close it up and leave. And it's like, that was a whole waste of time. And because of that, I'll call my daughter. And I say, daughter, hey, are you ready? And then the nurse will say, do you want some water? My daughter will sign that for me, and I'll say no. It's so much quicker, easy, and I like it better just because it's such a waste of time to go through the whole VRI process. One time I went in for chemo, and one of the nurses there was from Spain, actually, and she used gestures. And so she came up and gestured drinking. Do you want a drink? And it's like, this was so clear and so easy. And other nurses are like afraid to use any natural gestures. It's like, what is wrong with using gestures that make sense? A blanket, pulling something up over yourself, miming drinking something from a cup. It's like, you don't need VRI. You don't need to go through that whole setup for such a simple question as that. This is Sarah. It's like, wow, this has been a lot. We have different perspectives and different experiences of trying to go in and make sure it's accessible for deaf people in the medical office or hospital or whatever. But is there something, we've talked about a lot of things today, but is there something you would really like to just tell the medical professions about how to work better with deaf patients? I mean, I don't know, could we kind of summarize? Christine's already getting an excited face. Yes. work closely with me, the deaf person, not the interpreter. Work with the deaf person. And when the deaf person tells you what I need, if you start working with the interpreter, then the deaf people are going to just start being resistant. We'll be very resistant. And Sarah's saying, right, because you've already lost the trust. Because now they're looking at, and that part I get too, because I go in and I tell the doctor or whoever, I'm going to be behind you. I'm going to stand behind you so that the deaf person can see both of us at the same time. But I also do that because it's very awkward for the doctor to actually turn behind him or her to look at me and try to converse. It's something that I struggle with, and it's like, don't say ask her, tell her, does she have, it's like, just pretend that the voice you're hearing is from her. Just speak directly to her. Sometimes they get it. Sometimes it takes longer, but right. So, firstly, respect the deaf person. Is when they ask for an interpreter. Christine's going on. And also, if there's a medical person, if you've got a deaf brother or sister or deaf parents, feel free to share that. Like, oh, hey, yeah, I've got a deaf sister, my parents are deaf, or, you know, that it'll help us feel comfortable, and that we feel like you're not as limited, and then go through the interpreter. I mean, once a person knows that you've already got some experience, then it instantly helps us relax a bit so that we're more comfortable conversing with you. And if you start, gosh, even if you just started learning sign language and you're excited about that, please don't use this as a time to practice your ASL with me. You know, I'm there for the medical part. I'm not there to help you learn your sign language. If there's a sign language interpreted into my case, like, you can say something that, if you know something like, oh, do you want some water? Then sure, sign that. But don't come in and start practicing, hi, my name is, and then fingers, and being so excited that you know a little bit of sign. This is not the time and place for you to practice your sign language with me. I'm there for your knowledge, not for me to help you improve on something. So I'm deaf. I want to see, deaf. So Sara and Christine are trying to remember some of the points we want to be sure that were included. So deaf, respect your wishes, get an interpreter if you ask for that. Respect if you don't want BRI. If you've already got some sort of connection with the deaf community, share that. Sounds. Christy's saying, oh, right, yes, sounds. Do whatever to make sounds more visible. Also, Christine's adding, your bias. You know, your bias related to deafness is like, she's deaf, means she's stupid, or she doesn't understand the language, whatever. I mean, I don't know what your biases are, but each deaf person is going to be different. You don't know. You don't know who they are. So please, get rid of your biases before you come in the room. Just look at the individual person. Discuss the case that's there in front of you. If a deaf person feels comfortable, they'll ask questions. And if you show your bias, then we're going to shut down. And because we're not going to feel comfortable that we can ask you questions. It's Sarah saying that who pays the price? Right. And also, and this is Sara, that sometimes it seems that when you have a deaf person, it might take a little bit longer. And part of it is just the language. And even if you have an interpreter, sometimes it does take a little bit more time. So try to be a little bit flexible with the schedule. And Christina's nodding strongly, yes. And it also helps if you give any notes. You don't have to write down like on, you don't have to, you don't need to give me the notes like this coloring, like a coloring book. It's like, no. But just give me some nice professional notes. That would be very helpful. Oh, and Sarah's adding, oh, you mentioned earlier about sounds, to make sounds visible, but also anything visual. If you're trying to talk about something abstract, if you have a picture in your office or in a book or something. And Christine is adding, yes. For example, like if you want to explain a concept of cancer, draw a picture and label put the names on that. Because if you just throw it out and the interpreter spells out these different words, remember we have to process the information. So it's going from English to ASL, and then I'm trying to get a new word, and I'm trying to learn this, and it's very difficult, and it takes a lot of time for me to process that. So it'd be great to have the note with information, any drawings, with any labels, anything that you can make it visual will be so much helpful, so much better. And don't be afraid to use gestures. Just try. I mean, if you feel comfortable with the patient enough, you can. I mean, maybe have fun with it. I mean, the way you can joke around and let us know that you see us as human beings and not as a machine. I just, I don't know where we are on this, but it's like, I think that's the best to end it with. Like to see you as human beings. It's like any other patient that shows up in front of you. And don't see, I think sometimes hearing people say, oh, deaf, that's a problem. It's like, yes, Christy's saying we're not monsters. We're not monsters. And I don't know, maybe ask the deaf person what they want. Because, like, you've been deaf a long time. They might have just met you. So it's like, how do you want to proceed? Yeah, just show some respect. So wow, this has been, this has been a really enjoyable conversation, Christine. Thank you. Christine saying, yes, you're welcome. And I really hope that this conversation is going to help make the medical profession between the hearing people and the deaf people, and hope that they get a better connection, and that communication and that overall respect gets better. There's room for improvement. I agree. Oh, Christine, love you. This has been great. And Christine saying, love you too, Sarah. That's been fun.